Schneid guy.
So now we're going to talk about estimating the glomerular filtration rate, and it's essential to evaluating patients with renal disease. It's an index of functioning renal mass. It's important for serial monitoring used to estimate the severity and follow the course of renal disease. It's also essential in determining the proper dosage of drugs that are excreted by the kidney through glomerular filtration. Now, if we go and look at the equation, GFR is equal to clearance of creatinine, UV over P, which is equal to the creatinine production over the plasma creatinine. And what this does is it assumes at steady state, the production of creatinine by the skeletal muscle is equal to the renal excretion of creatinine. So we can say the GFR is proportional to 1 over the plasma creatinine, assuming the patient is in steady state. This is important because if we know that the patient's in steady state, if the creatinine in the plasma doubles, for instance, that would tell us that the GFR has been halved. Or if the GFR we think has gone down to 1/3 of normal, we would expect that the plasma creatinine would go up 3-fold. So this very important inverse relationship is based off of this assumption that the creatinine production, which is a metabolite of skeletal muscle metabolism, it's produced at a steady rate, that is going to be equal to the urinary excretion. And if we can make that assumption, we actually don't need to collect the patient's urine, but we can rather estimate the urinary excretion of creatinine through various formulas that can get a pretty close estimate of what the patient should be producing. And in that case, we can just look at the plasma creatinine to tell us about the patient's GFR.